If you've lost a tooth or you're in danger of losing one, you're not alone. In fact, studies suggest that as many as half of all Americans will lose at least one permanent tooth at some point in their life. Losing a tooth used to be considered a life sentence, with replacement options that were often uncomfortable, ineffective, or even impossible. Luckily, that's changed thanks to innovative new advances in dentistry. Of all your options for a second chance for teeth, implants are an excellent choice because they perform just like your natural teeth, restoring function and prohibiting bone loss while preventing damage to surrounding teeth.
When someone loses a tooth, a lot of different things can happen. What I find most patients concerned about is, one is the aesthetics of losing a tooth. You know, having gaps or spaces in your mouth can really affect the way we smile, can affect the way we talk with people. Gosh, it can make laughing embarrassing for some patients. But from a more functional standpoint, the loss of a tooth can truly affect someone's ability to eat, enjoy the foods that they like, and really start to limit their diet and some of their activities and where they eat different sorts of things because of that loss of tooth. From a surgeon standpoint and from a dentist standpoint, the loss of a tooth can cause other teeth to shift, can alter one's bite, and can affect the way we chew and can result in patients having pain with just chewing itself. Can you imagine a time in one's life where eating itself becomes an uncomfortable event? That's what can happen when we lose a tooth. Some people tolerate it better than others, but for many patients, that's just not an acceptable option. Dental implants are a wonderful part of my practice because it affords me the ability to help patients create beautiful smiles and recreate functional bites so they can enjoy chewing and eating and enjoying life and making teeth the last thing they worry about.
It's been completely sort of revolutionized my eating, my smiling. It had gotten so bad that I didn't even want to go to restaurants because I couldn't chew. And while everybody else was having steak, I would have to have soup, and it was an embarrassment. But now, I can do all that.
I simply feel better because there was some movement on my upper teeth. I'm not so concerned about my looks or how I'm able to chew, but it stopped the movement of the teeth. So I feel like it's stronger.
I'm 65 and I felt it was worth it. And so for anyone who's even younger than that, it's definitely worth it, okay? I plan on living to 120, but that's why. But no, it doesn't matter what your age is. If you want a quality of life and to the end of your life, then I would highly recommend it to anybody.
I'm extremely happy with my dental implant up to this point. It's been a very positive experience. He used my real tooth as the semi-permanent implant, and it's just made a world of difference. I can wake up every day and smile and carry on conversations with people. Dr. Sharma has changed the way I feel about dental work.
I can eat corn, I can eat meat, I can eat anything with the titanium implant. I am very, very grateful I took that option.
If you're making optional decisions, you really need, as a patient, to understand what's going on. Some people are more sensitive to your need than others. I personally think you've walked the walk of being alive long enough that you understand what your patient's feeling.
I've already told all my friends about Dr. Sharma, and that if they ever need any kind of dental work such as that I've got the doctor for them, because he's really just very, very, he's very good at what he does.
Couldn't emphasize enough that it was a pleasant experience. The man is a real professional. He made everything extremely easy. There was never even when complications arose with the jawbone and everything, he made it so simple that you weren't concerned. You were confident that he was going to do the job and it was going to be done right. And from start to finish, it was something I wouldn't mind going through again.
He is extremely detailed in how he explains everything. If there's any unknowns that you're feeling, it will be certainly cleared up with the way that he explains things for you.
They're very gentle, they're very calming. They calmed me down when I was there. They're very caring, and they do make you feel like you are the only person there in the office, even though there's a lobby full of people. When you go back to his office, you're the only person that is there, and it's comforting to know that he does take his time, and you're just not a number. You're a person.
He is an excellent speaker. He explains everything so thoroughly, and it would give somebody a chance to know more about it.
If you have any doubts or you need any explanations, I certainly would tell you to take and attend one of Dr. Sharma's seminars. Dr. Sharma will explain everything very thoroughly to you, and I highly recommend it.
I hope the information we've provided has been helpful to you. My office and I enjoy educating our patients about the option of dental implants and how it can improve your quality of life. If you found any of this information helpful or would like to learn more about dental implants, the process itself, or how we coordinate it with your general dentist, please come to one of our free seminars. Again, thank you for joining us, and please remember that you always have a second chance for teeth.